Kensington is hilarious and just great sometimes, but sad and evil. And stay in school and say no to drugs. As cliche as it sounds, I mean, it's not worth it, and it's not worth it.
How can a city thriving with businesses and economic expansion also be home to thousands of people living without a roof over their heads? In San Bernardino, despite signs of financial growth, thousands of men, women, and children face homelessness every day. They sleep on sidewalks, in tents tucked away in alleys, or crowd into shelters, often invisible amid the city's apparent prosperity. What does it say about our society when wealth and poverty coexist side by side, and yet so many are left to survive on the margins? In this episode of Travel Documentary, we dig deeper than the headlines and statistics to reveal the true causes of this crisis: economic inequality, the shortage of affordable housing, addiction, and mental health struggles. This issue affects every community. As you follow these individual stories, ask yourself, how close is this reality to your own neighborhood? And what can we do to close the gap between prosperity and human dignity? Does this work for your script, or would you like to adjust anything further? In January 2025, San Bernardino County reported 3,821 individuals experiencing homelessness. According to the most recent point-in-time count, a decrease of about 10.2% from 4,255 inches 2024. While this may seem like progress, experts caution that the true scale of the crisis is likely far greater. Many remain invisible, avoiding official counts due to fear, mistrust, or because they live in remote encampments or rural areas. As a result, the actual number of homeless individuals may be significantly higher. Of those counted, approximately 2,628% were unsheltered, living on the streets, in vehicles, tents, or abandoned buildings. These individuals face daily dangers, from harsh weather to heightened risks of violence, illness, and death. The remainder found temporary refuge in overcrowded emergency shelters, transitional housing, or supportive housing programs, resources that are often underfunded and insufficient to meet demand. San Bernardino City bears the greatest burden, with about 1,400 homeless individuals, nearly 1,000 of whom are unsheltered. Neighboring cities like Victorville, Fontana, Ontario, Redlands, and Colton also contribute significantly to the county's homeless population. This widespread issue debunks the myth that homelessness is confined to isolated, impoverished areas. It's a crisis that affects urban, suburban, and rural communities alike in a county with nearly 2.2 million residents. Homelessness is more than just a statistic. It's a human crisis. Consider Mary, a 7-year-old woman who lost her job due to chronic health issues, leading to eviction and homelessness. Now, struggling with addiction and facing stigma, she navigates a fragmented healthcare system that offers inconsistent support. Mary's story is echoed by countless others: veterans dealing with PTSD, families displaced by rising rents, youth aging out of foster care, and seniors living in poverty. The roots of this crisis are complex and interconnected. Economic inequality, soaring housing costs, lack of affordable health care, and systemic failures in mental health and addiction treatment all contribute to the growing homeless population. In San Bernardino County, median rent prices have surged by over 15% in the past 3 years, far outpacing wage growth for low-income residents. Meanwhile, the shortage of affordable housing forces many into precarious living situations or onto the streets. In response, San Bernardino County and its cities have implemented initiatives like emergency shelter expansions, rapid rehousing programs, and partnerships with nonprofit organizations offering outreach and case management. However, funding limitations, bureaucratic hurdles, and community resistance often hinder the effectiveness and scalability of these solutions. Critics argue that while short-term solutions are important, long-term structural changes, like increasing affordable housing and improving access to comprehensive health care, are essential. Social safety nets do exist, such as CalWORKs and Medi-Cal, but many homeless individuals struggle to qualify or face barriers in accessing these services. Mental health resources remain inadequate, with local facilities overwhelmed by demand. This gap forces many into a cycle of emergency room visits, shelter stays, and incarceration without sustainable support. The persistence of homelessness in San Bernardino reflects broader societal challenges, economic disparities, systemic neglect, and insufficient policy responses. It calls for more than just sympathy. It demands collective action, innovative solutions, and political will to transform the systems that allow so many to fall through the cracks. As the crisis continues, with real faces and stories behind every statistic, the question remains: how can San Bernardino and communities like it create pathways out of homelessness that restore dignity, stability, and hope? San Bernardino County has implemented various programs aimed at addressing homelessness by providing shelter, food, healthcare, and pathways to stability. However, despite these efforts, the region's social safety net remains fragile and strained. One of the key initiatives is California's Home Key program, which has invested over $35 million in San Bernardino County to develop modular and permanent supportive housing units. These units primarily serve chronically homeless individuals, veterans, and others facing persistent housing instability. Home Key also offers comprehensive services, including mental health counseling, addiction treatment, and job training to promote long-term stability. Since its launch, the program has helped over 500 individuals secure housing, though the demand far exceeds the supply. Another critical source of support is the federally funded Emergency Solutions Grant ESG, which finances emergency shelter operations, rapid rehousing efforts, and homelessness prevention programs. ESG also supports street outreach teams that engage with unsheltered populations and funds technology platforms like the Homeless Management Information System, which tracks cases to ensure better coordination. In 2024, ESG-backed services in San Bernardino helped over 1,200 individuals transition from homelessness. The CalWORKs Homeless Assistance Program targets families with children at risk of eviction, providing emergency shelter, rental assistance, and eviction prevention. Last year alone, CalWORKs assisted about 750 families in the county, offering critical support to prevent displacement. Despite these efforts, persistent challenges undermine their full effectiveness. Funding shortages limit the scale and quality of services, while fragmented coordination among various agencies complicates care delivery. The county's homeless population, conservatively estimated at nearly 4,000, far exceeds the available housing and support options. As a result, many individuals cycle through shelters, hospitals, and the criminal justice system without finding stable housing. Recent research highlights the effectiveness of the Housing First approach, which prioritizes providing permanent housing before addressing underlying issues such as substance use and mental health. Studies show that Housing First programs reduce chronic homelessness and improve health outcomes more effectively than traditional models. However, in San Bernardino, barriers remain. The county's affordable housing stock is low, with a vacancy rate below 3%, and waiting lists for supportive housing often stretch for more than a year. Additionally, wraparound services are chronically underfunded, limiting access to critical mental health and addiction treatment. In addition to government efforts, local nonprofits and community organizations play an essential role in filling gaps. Groups like the Inland Empire United Way and the San Bernardino Homeless Partnership run food banks, mobile health clinics, harm reduction services, and advocacy campaigns. Despite their tireless work, these efforts face significant challenges in scaling to meet the growing demand amid rising homelessness and economic pressures. This fragile social safety net raises important questions. Can current funding and policies adapt to the growing crisis? How can coordination between government, nonprofit, and community stakeholders be improved to ensure no one is left behind? And who is most at risk? Data shows that certain populations bear a disproportionate burden of homelessness in San Bernardino. Veterans make up nearly 12% of the homeless population, despite representing less than 6% of the general population. African Americans experience homelessness at twice the rate of their share of the population, reflecting long-standing racial and economic inequities. Families with children are another vulnerable group, accounting for about 20% of the homeless population, but often overlooked in data focused on individuals. Addressing homelessness in San Bernardino requires more than temporary relief. It demands ongoing investment in affordable housing, expanded mental health and addiction services, and systemic reforms to reduce poverty and economic inequality. The safety net, while vital, remains a fragile lifeline. Homelessness impacts people from all walks of life, but certain groups in San Bernardino County and across the United States are more vulnerable and face greater challenges. Understanding these populations is crucial to creating compassionate and effective responses. Older adults are among the fastest growing homeless populations. Many rely on fixed incomes like Social Security or disability benefits, which struggle to keep pace with rising housing costs. In San Bernardino County, home prices have increased by over 15% in recent years, pushing older adults to the brink. Without strong family support or adequate social services, many face eviction, ending up on the streets or in temporary shelters. Nearly 25% of the county's homeless population is aged 55 and older, underscoring the urgent need for age-appropriate housing and healthcare solutions. Individuals with mental illness or substance use disorders. People with chronic mental illness or substance abuse face a vicious cycle of instability. The lack of comprehensive care often leads to job and housing loss, which worsens their health conditions. According to the 2025 point-in-time report, around 40% of San Bernardino's homeless population suffers from severe mental illness, while 30% struggle with substance use disorders. The fragmented healthcare system and limited access to treatment leave many of them further marginalized. Survivors of domestic violence. Women and children who flee unsafe homes often have no place to go. They represent a significant portion of the homeless population, but are often undercounted due to fear and stigma. Emergency shelters for survivors of domestic violence in San Bernardino County have seen a 15% increase in demand over the past 2 years. These individuals need specialized support services to address trauma, safety planning, and legal assistance. LGBTQ+ youth. LGBTQ+ youth, especially those who are rejected by their families, face disproportionately high rates of homelessness. Nationally, LGBTQ+ teens account for 20–40% of the homeless youth population, despite making up only 7 to 10% of all youth. Discrimination and social exclusion push many into homelessness. In San Bernardino, LGBTQ+ youth often lack safe shelter options, leaving them vulnerable to exploitation and violence. Low-income working families. Low-income working families face the toughest choice between basic needs like food, healthcare, and housing. Around 18% of San Bernardino's homeless are families with young children, and recent economic pressures have driven eviction rates higher for this group. With a rental vacancy rate below 3%, affordable housing is scarce, putting these families at increased risk. Youth aging out of foster care or juvenile detention. Youth who age out of foster care or leave juvenile detention without a stable support system face a bleak future. With no stable housing, education, or employment prospects, many become homeless. Studies show that up to 50% of youth leaving foster care or prison become homeless within 2 years. While local programs in San Bernardino are working to address this gap, limited resources and funding continue to be a barrier. San Bernardino's demographic data clearly reflects these realities, and any meaningful policy must address the unique needs of these groups through targeted interventions. Specialized housing and outreach for veterans, trauma-informed care for domestic violence survivors, and inclusive shelters for LGBTQ+ youth are all essential. Recognizing these vulnerable populations highlights the complexity of homelessness. It also raises deeper questions. What systemic failures, such as economic inequality, discrimination, and inadequate social services, have fueled this crisis? How can policies break these cycles and create pathways to long-term stability? Understanding who is most at risk is the first step in developing tailored solutions that restore dignity and hope. The rise in homelessness in San Bernardino County is not driven by a single factor, but by a complex web of interconnected causes that create significant barriers to stabilization and recovery. Affordable housing crisis. The lack of affordable housing is the most urgent issue. San Bernardino faces a severe shortage of affordable housing units. According to the California Housing Partnership, the county is short more than 25,000 affordable homes for extremely low-income households. Meanwhile, median rents have increased by over 15% in the last 3 years, while wages for low-income workers have stagnated. This growing gap leaves many unable to secure safe, stable housing. With vacancy rates below 3%, the rental market is highly competitive and largely inaccessible. This crisis is not unique to San Bernardino. It mirrors statewide and national trends where housing shortages are a primary cause of homelessness. Economic inequality. Economic inequality exacerbates the housing crisis. Many workers in San Bernardino earn wages that are insufficient to cover basic living expenses such as rent, healthcare, and transportation, especially as inflation outpaces wage growth. With a poverty rate of approximately 16% higher than the state average, economic disparities are a persistent challenge. Job instability, underemployment, and the rise of gig economy jobs with limited benefits leave workers vulnerable to income loss and eviction. Mental health and substance use. Mental health issues and substance use disorders are significant contributors to homelessness in San Bernardino. Approximately 40% of the homeless population suffers from serious mental health disorders, while nearly 30% struggle with substance abuse. The local healthcare system is ill-equipped to address these issues, with a shortage of psychiatric beds, addiction treatment facilities, and overwhelmed community mental health services. Without timely, accessible care, these individuals often end up in emergency rooms, jails, or shelters, without sustainable support. Political and policy challenges. Policy and political challenges further complicate the solution. Laws that criminalize homelessness, such as ordinances prohibiting public camping or sleeping in vehicles, often force people into hiding rather than providing housing or services. Political divisions at both the local and state levels hinder the passage of comprehensive housing reforms and welfare expansions. Debates over funding also delay the expansion of affordable housing and essential support services, leaving many initiatives underfunded and ineffective. Impact of COVID-19. The COVID-19 pandemic has intensified these issues. Job losses and economic hardship during the pandemic pushed many people in San Bernardino to the brink of eviction. While eviction moratoriums and federal relief programs offer temporary relief, the expiration of these protections in 2023 coincided with a significant rise in homelessness. Recent data shows that new cases of homelessness in the county increased by 7% after the pandemic, highlighting the long-term economic scars left behind. Interconnected challenges. These issues do not operate in isolation, they reinforce each other. Without affordable housing, individuals recovering from addiction or mental illness have nowhere to rebuild their lives. Stigmatizing laws and punitive policies make it harder for homeless people to access services and shelter, further marginalizing them. On the streets of San Bernardino, this complex web plays out every day. As community leaders and policymakers debate priorities and funding strategies, the question remains: are current government responses sufficient to address these root causes? Or do we need bolder, more coordinated action to break the cycle of homelessness? San Bernardino's homelessness crisis is a microcosm of a larger national challenge, one driven by growing economic disparity, inadequate housing, and unmet social needs. While programs like Housing First and HomeKey offer hope, the road ahead demands expanded resources, innovative solutions, and deep compassion. The 3,800 plus homeless individuals are not just statistics, they represent real lives, each with a unique story. How we respond to this crisis shapes not only their futures, but also the moral fabric of our society. As you reflect on this issue, ask yourself, how will we act to ensure no one has to sleep on the street tonight? How can we turn awareness into lasting, meaningful change? Together, through awareness, advocacy, and action, we can work to end homelessness and rebuild hope for those who need it most.